Hello, my name is Dr. Caroline Walker. I'm an NHS-based psychiatrist and therapist, and I specialise full-time in the well-being of doctors and healthcare professionals. During the COVID pandemic, I've been making a series of videos about how we can help ourselves to stay well and mentally, emotionally fit during the COVID pandemic, and been sharing on a range of topics from things that I've been hearing and seeing doctors across the UK experiencing during this time. So today I'd like to talk a bit about working from home, because many of us have been asked to work in very different ways during the pandemic so far, and that will be ongoing for some time. And what I'm hearing from a lot of doctors and healthcare professionals is that, initially there was a bit of a kind of phase of novelty and perhaps a bit of excitement and a bit of stress as we kind of got used to new ways of working. But now we've been doing that a little while, it's actually getting quite draining, quite exhausting, and starting to see some of the longer term consequences of people working in different ways, and particularly from home. And when I say working from home, I guess I mean exactly that. Anyone that is having to do their work from home. I mean, I'm hearing about, GPs having to do, 20 phone calls back to back, hidden in their bedroom away from while their two kids are downstairs, and things like that. Or you may be fortunate enough to have help with childcare and other responsibilities in a designated working space. But essentially I'm talking about any of you out there who have had to be working in a different way to normal, that may be all the time or just some of the time. I'm hearing a lot from doctors who are starting to feel quite exhausted and drained by working, particularly virtual working, spending all day either on the telephone or doing kind of Zoom calls or online consultations. I'm hearing the start of a lot of kind of longer term sort of musculoskeletal niggles from people sitting in different postures and bent over laptops instead of at properly positioned desks and desktops. I'm hearing a lot of people quite disillusioned actually, and quite unsatisfied by their working online, realising just how much of their job satisfaction as a healthcare professional, as a doctor, came from the human contact that they had every day with their colleagues and with their patients. So it's really affecting people on many levels, on the kind of emotional level in terms of the level of satisfaction and emotional engagement we're getting with our work, on a physical level in terms of eye strain, headaches, fatigue, even the changes in pattern attached to things you might not necessarily think of, like the change in your breaks times and when you eat and when you drink and when you move. And I think that we can't underestimate that the lives we were living, there were lots of built-in little spaces. There were lots of moments where we might walk to the loo and see a colleague and have a chat, or we might be going to make a cup of coffee and bump into somebody in the corridor. And all of these things might seem little tiny things, but actually they really add up because they are a social interaction with other human beings. They are movement and moving your body into a different space. They allow your brain to think in a very different way, going from focused mode where you're in your zone working on your computer to a more diffuse mode where we tend to make different connections. And it's really, really important for our well-being to have enough of that space. So there's a lack of those spaces within our day-to-day life, as we run call after call after call, but also a lack of space between our working life and our home life. So whereas before people would have a commute where they might listen to a podcast or chat to somebody on the car phone, or maybe just let their mind wander and at least have a sort of transitional phase between being at work and being at home. Now that has just disappeared for so many people. They're kind of just 1 minute sat here working, next literally 10 seconds later they walk through a door and they're and they're back in home mode, and that can be very difficult for us, because as humans we tend to live our lives in roles. So we tend to be, okay, I'm in work mode now, or I'm in parent mode now, or I'm in friend mode or lover mode, and actually it's very difficult for us when those modes get too close together and the boundaries start to blur. So we might start to take our work with us into our home life a bit more, and vice versa. It can be really hard if you've had a really difficult morning trying to get your kids to behave or to eat their breakfast or to whatever, to then suddenly, like 2 minutes later, be on a phone call and being in professional mode. So we've lost that sort of third space, that sort of zone between the buffer between work and life as well. So there's lots and lots of impacts and effects, and you may be able to resonate with these if you've been working from home at all. And so there's also lots and lots of things that we can do to help ourselves. So really try and think for yourself, what is different? What's the big differences now between what you were doing before and what you're doing now? Is it that, your chair setup needs to be a bit different? Is it that you've lost all those little natural breaks in the day that you used to have? Do you need to be putting some of those back in and allowing yourself to not book things back to back to back to back, but to book in regular little 5-minute or 3-minute or 1-minute breaks even? Is it that you've not got a way of transitioning from work to home? And with that one, you can do all sorts of things. So you could literally walk out of your front door, go for a 5-minute walk and come back in. You could give yourself a little commute, or you could do something really simple like a visual cue, like wearing a lanyard when you're working but taking it off when you're not, or changing your clothes, just something that kind of cues your brain into, okay, I'm now actually physically shifting my brain and my body out of work mode back into home mode. Because I think it's really important, particularly if you're going to be continuing to work from home for the foreseeable future, that you start to look at the impact that these things are having on you longer term, because we can all manage a bit of a change for a few days or a few weeks even. But when things start to set into a few months and we've not addressed them, then we can get into real problems. And what I'm starting to see now a few months down the line is doctors and healthcare professionals sort of saying, well, yeah, it was kind of all okay to start with, but now I'm really feeling like I just don't have any job satisfaction anymore. Or that slight niggle I had in my shoulder at the beginning has really turned into a really problematic shoulder pain that is now keeping me awake at night. Or actually, I thought my partner and I were arguing a bit more, but and I thought that would settle, but it hasn't. Or so if you're starting to notice there are things that are just wearing you down, that do look at your day-to-day routine and look at the little practical things that you might be able to do to help yourself. So really focus on putting in those breaks, however short they are, even if it's just a 5-second slow breath in and out, and then you visualize something like the last holiday you were on, or a beautiful vase of flowers or something, even if it's just a little tiny mental break, that's effective as well. Think about some physical breaks. Do you need to be getting up, moving around? Do you need to set an alarm on your watch, for example, or your phone that says, okay, it's been an hour, time to stand up, stretch, move around? And do you need to put in a break between work and home, either going to or coming home from, or both? Because are you carrying the two roles, one to the other? So have a little think and start to take control, because it's your working life. It's your body, it's your mind, and nobody is going to come in as a doctor and a healthcare professional. No one else is going to come in and say to you, you must do this. So it's really important that we do this, take responsibility for ourselves. So I'm having to do this for myself. I'm having to think about whether I put breaks in between my sessions, how many sessions I do in a day, the expectations I have on myself between going from where I sit here to work to going, next door to my house and my family. How do I, shift out of one to the other? So this is affecting all of us. And I think it's really important that we each take responsibility, and because we can make little changes that are actually going to really, really help us in the long run. Not to become too burnt out and disillusioned. And just one quick last tip, just connect with the meaning of what you're doing. Remember why it is that you became a doctor or a healthcare professional. Remember why you're doing what you're doing, because if we're connected to that, there's no better motivation in the world. to help us. And as always, please do get in touch anytime, caroline@joyfuldoctor.com, if I can help you. If you're struggling and would like signposting to further support, I'd be very happy to do that. Bye for now.